we're going to get started talking about cancer, and some guest speakers are going to join us and sharing their stories and the realities of cancer. I'm Stephanie. I'm one of the co-founders and co-presidents of Invisible Illness Awareness Network. I'm a white woman with brown hair wearing a gray blazer and a black t-shirt. We're a 501c3 nonprofit organization that raises awareness about invisible illnesses, chronic illnesses, and disabilities. And we also support students starting affiliate organizations to become leaders for their peers and educating their peers and foster inclusive environments at their campuses. We're doing the Invisibly Aware series, which is monthly meeting talking about a various invisible illness topic. Some important disclaimers before we get started tonight. Please don't take anything said tonight as medical advice. Please consult your doctor if you have any medical concerns. And please note that each person with a condition is unique, even among individuals with the same diagnosis or same type of cancer. And please also note we're not experts on these topics, but our guest speakers are experts on their own personal experiences and on their bodies. And with that, I'll pass it off to Morgan.
Hi, everyone. My name is Morgan. I am a white woman with long brown hair, and I am wearing a blue t-shirt. One of the first conditions we're going to be talking about today is multiple myeloma. This is a blood cancer that initially develops in plasma cells, but it can spread to the bone marrow where it affects the ability of the plasma cells to generate antibodies. The cause tends to be genetic, but there's still a lot of research going on to identify that more specifically. It is also important to note that a family history of this disease can pose a risk, but it cannot be inherited from someone. So again, they're still trying to figure out the specifics of that, but the genetics tend to play a role in their suspected causes. For symptoms, patients often experience bone pain, fatigue, weakness, anemia, frequent infections, and kidney problems. For prevalence, in the United States, the individual lifetime risk is less than 1%. For treatments, treatments might not always be used in the early stages of the condition, but as it progresses, immunotherapy, chemotherapy, bone marrow transplants, and other targeted therapies may be utilized. The other condition we will be talking about tonight is cervical cancer. This is a cancer that begins in the cells of the cervix, and the cervix is the lower part of the uterus that connects to the vagina. The causes are mostly by HPV infection, but there can be other influences as well. For types, squamous cell carcinoma is the most common, but we also have adenocarcinoma as well. For symptoms, it tends to be abnormal vaginal bleeding, heavy and prolonged menstrual bleeding, abnormal vaginal discharge, and pelvic pain. For prevalence, it accounts for about 0.7% of all new cancer cases. And for treatments, it tends to be surgery to remove the growth, radiation, chemotherapy, immunotherapy, and other targeted therapies as well. Alrighty, I'm going to go ahead and pass it off to Nkanksha, who is going to allow our guest speakers to introduce themselves.
So hello, everyone. My name's Akanksha. I'm a brown woman who's wearing a pink low neck shirt. And so tonight, for our guest speakers, Yolanda, who goes by Myeloma Chick on Instagram, full myeloma advocate and certified patient leader, as well as a certified personal trainer. We also have with us tonight Samantha, who goes by Go Sam Grow on Instagram, who's a recurrent cervical cancer survivor and women's health advocate. So now you both can please introduce yourselves and share a little bit more about yourselves as well, if you'd like.
Hey everybody, I'm Samantha. I live in Henderson, which is a suburb of Las Vegas in Nevada. I started my cervical cancer journey when I was just 26 and had 2 recurrences afterward. But I have been in remission for 6 years in April. And as you can imagine, I've learned a lot through that experience, and I'm grateful to be here to share that with you today.
So, hello everyone. Thank you for having me. My name is Yolanda. I go by Myeloma Chick. I'm a Black woman with shoulder-length hair, color brown. I'm wearing a striped shirt with a blazer.
And I'll go for my accessibility as well. I'm sorry I forgot that earlier. I am a Mexican and Filipino woman with middle length hair, and I'm wearing a black sweater. And my pronouns are she, her.
Thank you both for introducing yourselves. So we'd like you both to first share your experience with living with your respective invisible illnesses. You can start talking about some of the symptoms you started experiencing, and a brief description about how your condition affects you.
Well, as I mentioned, I was first diagnosed at 26. I experienced many of the symptoms that you had mentioned in the first slide. There was irregular pain, bleeding, fatigue, and this went on initially for several months. And it would take multiple doctors, multiple discussions, and after those several months, I would finally have an answer. I was diagnosed with early stage cervical cancer and was treated with surgery. And then 2.5 years later, I'd have my first recurrence. And then about a year or so after that, I'd have my second. So those symptoms all happened at once sometimes. Sometimes they would be separately, depending on each diagnosis. With that said, I had to get very comfortable with my body and very comfortable about talking about these very personal parts. And that has really taught me the importance of voicing that, especially as a woman. I think we are not necessarily empowered to have that agency over our bodies. So that's absolutely something I've taken away from all of this.
For sure, and you're being your own advocate throughout your journey too, and making sure that your voice is heard amongst medical professionals for sure.
I didn't really have any early symptoms. Like multiple myeloma is such a special little cancer. Okay. So for me, it was just a regular doctor's visit and blood work. And that's kind of what the call out was. I tell people the two symptoms, if you will, but wasn't really a symptom. What I would have, like if I was going up the stairs, my knees would crack. But then myeloma affects the joints and the bones. So, okay. But nobody is thinking cancer, you know what I'm saying? So the other thing was a craving of starch. So I told people that they're like, oh, that's interesting. I would have a craving for white rice, cold, just very weird things that I don't really do. So that was the only call out. Like this was a typical doctor's appointment. Here's the blood. Let's do this. And we're good. That wasn't the case. So um, my doctor, he called me. Like, we never want a call from our doctor. Like, you just kind of want the blood work to be good, and then we are about, be about our way. So he was like, okay, your protein levels is extremely high. I forget what it was. I think it was 3,000. Like, I forget. Um, and he said you have to see a hematologist. So it's such a long story, but I found a hematologist who um wasn't who I needed. Like down the line, it's like a learning curve. Oh, I need a myeloma oncologist. Okay. Like I said, it's a long story. So for me, I had two doctors. The first one wasn't a fit for me. Um, and what I like to share too, that's important. I'm like of the 1 to 4% in the age group who is diagnosed with this. This is something that people of 60 and up usually are diagnosed. So I was in my 30s. Okay.
It's an exhausting story to tell, any patient's story and just journey of getting first diagnosed and learn the whole learning curve like you mentioned. And it's unfortunate that the first person you seek help from during your medical experience isn't always going to be the one who will be able to help you the most or help you where you need to be helped. And it's all trial and error. So thank you for sharing that. And we'll get more into it as we keep going on tonight. Yeah, both of you kind of already touched on our next question with this telling us about your journey to getting diagnosed. Like, how long did it take for you to seek help after noticing symptoms? How many doctors did it take to receive your diagnosis? And what your emotional reaction was to getting a diagnosis? You kind of touched on that, like the symptoms that you had, and like some even just like not really noticing any symptoms, kind of seeing them in hindsight, like looking back, being like, oh, that does make sense. Um, but do you have anything any other thoughts to share regarding those things?
Mm, I would say with my first recurrence, I think emotionally it hit me so much harder because I had already had a history of cervical cancer and felt like I was so invalidated through that process. Like to only have to prove my illness once again. So in a way, there's some relief, small relief in finding out like, okay, I'm not imagining things. This is actually happening, but also just processing the pain of feeling like you don't even know what's going on in your own body. Um, and I guess finally feeling like, oh, okay, I was right. I was right that there was something going on. And I'm glad that I followed my instincts and probably something Yolanda feels too. I'm glad, as you mentioned, Stephanie, that I advocated for myself and I kept pushing. Finally, with my third recurrence, I was in a place where I had doctors who were very supportive, very validating, very open, and that made a world of a difference. So I always like to tell people, and women especially, because unfortunately, that is just how things are in our healthcare system, that we don't need to settle. Always ask for that second opinion. Always keep pushing and trust yourself.
For sure, and, like, best worst case scenario is there is nothing wrong, right? Like, we don't want there to be something wrong, but you know your body best, and you know when something's not right.
Yeah.
Um,
At least you have that peace of mind
mhm.
if there isn't anything wrong, but always just go the extra mile because truly like it's your body, it's your health, it's everything.
I agree. What I would like to piggyback to say as well, from my experience, since I was rather young, um, it played a huge part in terms of the advocacy because um, even though I didn't know the word, well, I knew the word, but my whole experience with the word later on made sense. But in the beginning, it didn't. So the hematologist who I had, um, it's just like a weird story because of the age and because this is something people of a certain age may be diagnosed with. The hematologist was not familiar with someone like me coming into the office. So there were a whole lot of people who were probably 80 and up who had various blood, whatever. So it wasn't funny at the time, but imagine this young Black woman coming into this office. Everyone in the waiting room is of a certain age. The doctor hasn't really seen too many people in this predicament that I was in. So automatically he was like, okay, well, you have multiple, like I said, it's too long a story, but the short version, you have multiple myeloma. Don't do this, don't do that. There was a whole lot of kind of that. Um, you have to get on this drug. I don't know if you should say that the name of the drugs, but the drug I knew because it was something that I think a lot of people knew. It was something that people with leprosy take. Okay. So that right there was like, yeah, this ain't gonna work. So with a doctor friend of mine, like I said, it's a long story. She said, you know what? Maybe you should look into another doctor, which I did. I found another doctor. found out I was asymptomatic. So, asymptomatic means we don't react right away. Okay. So, if I would have taken the suggestion of the hematologist, I don't know. I don't know if we would have this conversation right now. If I would have just been the obedient patient and just kind of listen to what you're telling me without, okay, something doesn't seem right. So, yeah. But processing the diagnosis in the beginning, it was tough. Okay, because you're just not expecting it. Like no one is expecting to be diagnosed with any of these conditions. So it was a little rough. Okay, there was a little crying, there was a little why me, and then afterwards, I think with the whole advocacy and plus me asking certain questions, then I kind of got out of that funk, if you will, to kind of really be up on to research. What is this thing that I have? What are the other options? So, yes, the beginning, it was processing, but it took a little bit because some of us are all different. Some of us process, it can take a couple of months, a couple of years to kind of, no, mine was quick. Okay. I did the boohoo and all of that. And then, okay, let's rock and roll.
Yeah, I definitely hear you, and that the journey isn't going to be linear, and there's going to be a lot of things you have to learn for yourself. And kind of that's, I think, how sometimes for advocates, that's how the journey is paved to become an advocate. You're almost forced to become an advocate for yourself if you want to get better and take your health into your own hands. And this is going to actually lead us into the next question as well. And you guys have started talking about it, which is how has your day to day life changed? And what challenges have you guys faced over the time? I know there may be many, but if you guys could maybe highlight a couple of challenges that also maybe changed your self view.
Sure. My day to day is very different. Um, I realized the other day that it's been 10 years since I was first diagnosed. So there is the actual maturing that goes on. But if you're lucky enough to be on the other side of this of cancer, it truly does change you as a person. Um, my life perspective is different. Uh, I prioritize myself a lot more. Um, so I guess that's one thing is that don't wait until something catastrophic happens in your life to put yourself first. But on the day to day, my final recurrence, my treatment resulted in me having two ostomy bags. So now my body functions completely differently. Something as simple as going to the bathroom is it's an entirely new experience. So that took a lot of adjusting. And just on a physical level, I over the years have had to maybe not it's not that I can't do the things that I used to do, it's just a lot of adjusting, a lot of preparing and, really gauging, "Okay, do I have the energy for that?" Or, "How am I gonna be able to recover after if that's something that I really wanna do?" Um, and it's the same thing mentally and emotionally. I've had to we talked a lot about processing, um because my first two recurrences were so close together and I really didn't have the time to process what happened. I really didn't get to that into like years into my recovery. And it's amazing the things you learn about yourself, the things that you feel like you have to let go, if you will. Um, and as I said, just evolving into a new version of yourself, which comes with a lot of grief too.
That was so beautifully said.
Thank you.
Everything Samantha said, I can say ditto because um, I think it's like a new day, right? Like for me, I'm able to do a lot of stuff that I did prior. However, I'm cognizant of the pros and cons if I do certain things, if that makes sense. So, perfect example. So, as you mentioned, I'm a certified trainer. So, um, that's a whole other story. So, this is kind of what I do. However, last week I decided to be extra. Okay, I be extra because it was a while before I did this particular routine that I was doing. It took me 5 days to recover. So things like that, things that could be simple for someone else to do, it can still, it's simple for me to continue to do. But it's that, however, like, okay, if if you do this that way, you're going to pay for that, possibly. And that's what happened. Like today, maybe it's about a week now. I know I said 4 or 5 days. It's close to a week. And it's like, okay, we can't do that right now. We have to do it in stages, perhaps. But it's like a whole shift of certain things. Of, okay, let me think, you know, maybe I should say it that way. Like, let me think about doing certain things because there's going to be a reaction. Okay, because this isn't back in the day. This is going to probably be catastrophic if I proceed.
Yeah, that makes sense. You're both talking about, like, adjusting to your new normal that you find. It's like it's something that, I mean, doesn't necessarily happen overnight, but it almost feels that way because once you know, what your diagnosis is, what your treatment plan is, like, how you are affected by things, it's different. It's a learning experience every time you try something that you did before you had all these new things happen. And I know, Samantha, you touched on it being kind of like a grieving process, and it is. It's like I feel like that's something that a lot of people with chronic illness, invisible illnesses relate to. It's like you're kind of grieving your past self and what you thought was your normal, but you have to adjust to what's your new normal. Getting to know your new self. It's not like your whole worldview necessarily changes per se, but parts of you do change. And like you said, it's like you're getting to know, I just keep saying the same thing, but, like, your new normal and what's how you adapt with that and how you weave that into your life and make adjustments to it.
Oh, it's so true. And I guess one thing that I would add to that too of that entire process that sticks out in my mind is just the level of guilt and shame that I would feel when things were different. Obviously now I have the hindsight to be able to appreciate that, but in the moment, when you are processing, like, okay, hey, this I can't do it like that anymore, or whoa, I'm having a really bad day, week, months, even. Um, yeah, I guess just gaining that perspective has been huge. I think probably any patient, anyone with that deals with regular illness is something that we have to make peace with. Um, and I'm constantly reminding myself. I sometimes will revert back to, I guess, old way of thinking of like, no, I've been very excited and like eager to get back to life and having a sense of normalcy. But then I push myself so hard I gotta take the reins back. So it is always a balancing act. Sarah mentioned it too. We every day is different and constantly, even to this day, learning how to walk that line.
For sure. And especially I feel like a lot of people tend to be of the mindset that you need to be productive all the time. I feel like that's just ingrained in our society in general.
It is.
It's like something I literally have a laptop sticker that says your productivity does not determine your value. And that's something that I think a lot of people with disabilities and chronic illness tend to struggle with too, because it's like if you have or being having a rest day is productive. You're allowing your body to reset and get to the point where you can do what you wanna do and strategize, like Yolanda, you said, like, you have to take what you learn from how far you push yourself and kind of readjust for next time and figure out what's, like, a safe thing for you to do next, and that's part of it, it's part of the whole process. But thank you both for sharing. That's kind of touched on this already, but what, different approaches or treatments have you tried for your various conditions? What worked and what hasn't worked? And you don't have to list all of them by any means, just maybe some impactful ones or things that stand out to you first.
For me, I really run the gamut of treatment for cervical cancer. Started with surgery, continued with different surgeries. I've had chemotherapy, immunotherapy, radiation, and it's been invasive to say the least. Surgery is tough on anyone. I don't think anyone looks forward to that experience, but then to have your very personal parts of your body, uh, up how am I trying to say this? It's something that I've had to learn to be comfortable with and to be comfortable in my body and as we've mentioned before, like really advocate for myself. What am I comfortable with? What kind of boundary do I want to um make sure that I'm raising? Um yeah, and in the moment as a cancer patient for myself, I guess I don't want to speak for anyone else, but you're not really thinking about those kinds of things. You're thinking like I'm going to put my head down, I'm going to get through it and I'm tough. And it really isn't until treatment's over and you finally have that time to be like, whoa, I remember all of that. And I I have to work through I have to be intentional about how I'm going to work through going through all of that. So that has been um, something interesting and something that has taught me a lot going through treatment. What would you say, Yolanda?
I agree. I okay. For me, I would say, well, first I'll say I've done radiation treatment for a few rounds. Because I had like a chest sternum thing poking out, which was a sign. So I guess that was a symptom. But that was when I was diagnosed, if that makes sense. All of a sudden, things was happening. Um, and then I had the treatment that usually occurs with myeloma. Luckily there's more drugs now. There's more options. So that's like that's another conversation. But I would have to say, it has been an adjustment of coping and found, what I've found is that no one else is going to do this walk but you. Okay. And though I have a nice little small group of support, family, friends, and all of that, they're not going to take what comes along the way with what we got to go through. Okay. Like, I love everybody to death. However, you're not the one who has to take this needle in his stomach. Okay. You're not the one who has to go through this trial of finding a vein because you've kind of depleted all veins in one arm. Now we have to find on the other. Like, you can explain the process to your squad, if you will, but it's like no other. Okay. Like, you're not going through this. So I'm explaining it. And for me, I don't want any pity. I don't think any of us want that. However, I feel like, okay, it's like a two-stage door, if you will. Appeasing everyone else to explain, you're doing well. How you doing? Yeah, I'm doing okay. And then you faced with, how am I going to mentally be ready to start this treatment that I got to do right now? Like, if it's every week or every day or whatever your situation is, like, each time that was a trial for me. Like, who's the nurses? Who's like, who's the team today? Okay. Like, do you know how to get a vein? Like, all of these situations. Are you new? Okay. It's like stepping out of your comfort level if you haven't been, I guess, boastful about certain things. And maybe I have, but I feel like being diagnosed and having to go through this, I've been quite out there. So if something for me doesn't seem like it's hitting properly, I'm going to say something. So, yeah.
For sure. As you should speak up. And like you said, like you can explain all you want to, like you said, your squad, like your group that's supporting you, but no one really understands unless they go through it. You can empathize with someone and you can understand they're going through a hard time. You can understand that they're in pain or they're going through a lot of different symptoms that are new for them, but no one really understands unless they go through it. But that's an excellent point. Thank you for sharing and being vulnerable with that.
Yeah. Our next question is about what challenges you guys have faced within healthcare systems, educational systems, or workplace, and especially when it comes to getting support or not having it at all. So if you guys could also talk a little bit about that. It's such a great question because I feel like this part of cancer doesn't really get talked about enough. I lost my job in 2018 because I had to do treatment full time. And I have not had a traditional job since then. Um, I transparently, like I lean into advocacy because it's something that I'm passionate about and but also it's my way of uh making like a career again and starting life over. I wish there were more resources. I wish that the social part of cancer was addressed more. There are so many programs and resources available that I, like, to this day, am still finding out about, and they would have been really handy when I was in the thick of treatment or when I've just lost my job and we're just relying on my husband and his income. These are very real things that happen to patients that we're just sort of left to figure out on our own. And oftentimes they're not an individual thing that someone can figure out, especially when you're actually fighting for your life. And I absolutely think just as a society we could stand to benefit talking about these things and working towards supporting patients more in this way. And just to wrap up that question, I think emotionally, as Stephanie mentioned, that takes a toll on our mental, emotional, just how we see ourselves as a person. Um, it wasn't my fault that I lost my job, but I certainly went through that phase of like, wow, I don't feel like very worthy. I don't feel like I'm bringing a lot to the table. Um, Obviously, from a lot of social conditioning, but and that's something that I've had to unlearn. And I appreciate the opportunity to be able to take a step back from that. But that's just another added burden that cancer patients, especially younger cancer patients, face that there needs to be more support for sure.
But I just wanted to add, Samantha, you're so on point because sometimes that conversation is not had. And again, it's an individual thing. You have to go through it to realize that, oh, this is another issue that I wasn't expecting. I can say for myself, I didn't tell my employers that what was happening because for me it was like it's none of your business. Okay. And the industry that I was in, so I was in the fashion industry. The fashion industry is tricky. Okay. So, um, the thought that I had, what is the point of me telling you that I have this invisible situation because I look perfectly fine? Okay. I'm coming in here with heels on every day, with suit on. Like, you have what? What's that? No. So I was like, okay, yeah, we don't need to tell you anything. And considering I was at the employer that I was with, I was there for a good many years. So I knew I had like a little seniority if I needed days off and all of this other stuff. Um, or if I need to come in a little late, there was a little flexibility. So if there's flexibility, that means I don't really have to tell you everything that's going on. Because especially if you know it's not going to benefit you. So I say all that to say there was an incident when I guess that was like the trial of finding another doctor, another second opinion. And the thought was to have a visit at the Mayo Clinic, right? So the supervisor who I had at the time, they're going to try to be nice. We had a sit down conversation. Oh, I'm going to have to, I have some things that's going on. That was my first, we have to have a conversation now versus the secret that I have because I'm going to need a little extra time off because a Mayo Clinic is far. So, had a conversation, tried to explain what multiple myeloma is, which is also a little tricky. She says, oh, that's like when I had a foot spur. Okay. So she compared, I'm telling you, I have cancer, sweetness. And you're talking about a foot spur. So in my mind, all of this is working as the aha moment. This is why, for me, my opinion, I don't think it does you any justice as telling HR and all these other people about your business because I feel like it goes in one ear out the other, or it can probably be used against you to some degree. Like, I don't know. So once she mentioned a foot spur, the conversation to me was like it was dead. I was like, okay, let's roll this back over. And then to kind of say, I didn't really need to go because then we found out, like we did a what do you call it? A telephone conversation with someone at my Mayo Clinic who was well renowned. So he was getting ready to retire. I don't even know how I found the man, but he was gracious to have a conversation with me, faxed him over my, because this was many moons ago if I'm faxing. Okay. Faxed him over my stuff. And he was able to look and kind of diagnose, no, this is asymptomatic. Okay, cool. Here's a list of some doctors in your area because it was New York. At the time, pick a doctor. He knew all of them. They're all very good doctors, but they're myeloma oncologists. Okay. So once oops, sorry, my mic fell. Once that was confirmed, I didn't really need my manager and employer to know anymore. Like I had to, that was a lot for me telling them that much. So based on her foot spur and then finding out, okay, I'm not going to, I have a chance with, you know, where we're at. Okay, you can go on over here. Okay, conversation is done. Like there was no more. I didn't bring up anything else about my health. Uh, I did treatment. I tell a lot of people I did treatment way early in the morning. Like I had it arranged and I was lucky. Way early. Do whatever it is you have to do. Where I can kind of ride uptown to my office. And usually I would get there before everybody else in my office. So that's kind of what we did for a couple of years. This is my business. So, yeah. Uh-huh.
No, for sure. It's hard to have that balance of how much do I tell my employer, or if you're in school, how much do I tell my professors? How much do I tell other people? Because will they understand? Will I actually gain anything from this? Will I be accommodated, or is it going to be used against me? It's hard to judge, especially when you don't personally know people in your workspace. And you had no idea she was going to talk about a bone spur and try to connect, or foot spur and try to connect to you in that way. But it's like there was an attempt. It's not the same thing, but it's like it's hard no matter which way you go around it. And I'm sorry you had that experience. I can't imagine the thoughts that were going through your brain in that moment. But I'm glad you did, find a solution with the Mayo Clinic, like, they found, a list of resources for you to access closer to home, and made that work.
Yeah. There's a lot of mental gymnastics that we just always have to go through and put ourselves through in order to find out who we can find for support without the support of getting to that place. And we're all always doing that by ourselves. And I'm so glad that Samantha, you were able to pivot yourself into a position where you're helping other people find those resources too. And Yolanda, with your story too, it helps other people learn that, okay, I can put myself in a position where I can just take a bigger step and advocate for myself and know exactly how to approach these kinds of situations in my workplace, not spend a lot of time almost being trapped here, right? And not knowing and being stuck. And you took that action and you kept yourself moving. So that's very inspirational.
Kind of moving towards our last questions here. Is there a specific piece of advice that you would give someone who's newly diagnosed with cancer or your specific type of cancer? And if you could try to keep your response just to a couple sentences. I know that's easier said than done. There's probably a lot of things that you'd like to advise others of, but what's something that stands out to you most?
For me, when it comes to employment, especially since it's on the brain, know your rights as an employee and make sure that you're covering your bases as far as that goes. Because as Yolanda mentioned, that sometimes these things can be used against you, unfortunately, and it's better to protect yourself. Um, in short sentences, I would say trust yourself, speak up, and um, just always put your health and yourself first. Like your health is absolutely worth prioritizing. Um, and for any cancer survivor to take that pressure off, we have been through enough in any cancer experience. We don't need that extra hardship, especially from ourselves. So um, I guess that's where I'll leave it.
For me, I would say to, I don't want to say embrace, but to be in the moment of where you're at today, right? I tell a lot of people, currently I'm in remission. So it's been a trial for like over a decade is when I was diagnosed. So in terms of relapse, those type of conversations I try to steer away from because right now I'm in this moment. So I would say take a breath, okay? Because it's a roller coaster, and it's those peaks, right? It's up, then it's down, then it's those curve, okay? Those little curvy things, and just be in a moment. If the moment is treatment with this new drug right now, and getting your body acclimated to what comes with that, focus on that. Okay. And then hopefully getting those numbers down or whatever the situation is. And then if things are looking good, okay, what's the next goal? Okay. Where should I focus? But I try to be in the present. I don't know what a year, 2 years is going to be. Right now, I'm good. Pain here and there. Okay. Because there are those remnants and there is this life of post treatment that a lot of people don't speak about. Um, and that's kind of where I'm at, just trying to shift and move along as I need, with the hope that relapse isn't part of the conversation. But I would say if it is part of the conversation, then we tackle that and that time. We're in 2026 right now, so
I just want to say that Yolanda really nailed that point of staying present. I think as a cancer survivor, it's really difficult. I found myself dwelling and thinking about the past a lot, and then also being, as she mentioned, very anxious for the future, very worried about any possibility to come. So to anchor yourself in this present moment, Yolanda, that is probably some of the best advice for someone going through this experience. Easier said than done, but yes.
For sure. It takes a lot of strength to stay present in the moment and not thinking about XYZ, what other plans can happen, because anything can happen at any time. But it's also something that you can kind of use to remind yourself too is like I could get hit by a car tomorrow. Like you can't ever plan for each day. You don't know what's going to happen. So my something my great grandma used to say all the time is worry is like a rocking chair. It keeps you busy, but it gets you nowhere. And I try to remind myself of that a lot. And thank you for sharing that. It does take a lot of strength to stay present in the moment for anything in life, especially your guys' situations. So thank you for sharing that. So thank you so much to both Yolanda and Samantha for spending your night with us tonight and being vulnerable and sharing your experiences. We really appreciate your viewpoints and just everything you've brought to the table tonight and had us think about. So please check them out on their Instagrams that are on screen. Myeloma Chick on Instagram for Yolanda and Samantha at Go Sam Grow on Instagram. We really do value your input and thank you so much for volunteering your time tonight.
Thank you both much for having us, and thank you, Yolanda, for sharing this space with me and sharing your story too.
thank you, Samantha. It's a pleasure. Thank you, ladies. This was wonderful.
Of course. Thank you for joining us. And yeah, so upcoming events and topics. All of our events are open to everyone. In February, we're going to be going over connective tissue disorders. Our date is February 11th for that at the same time as tonight. And in March, we're going to be doing autoimmune conditions on Wednesday, March 18th. We do have our social media. We're at invisible_illness_network on Instagram, and our YouTube is IIA Network. And our website has a lot of different resources too. We have a newsletter, monthly reminder for our meetings of when they're happening, and you can scan our QR code to find our link tree with more links, including that newsletter, and just links to other resources and our different affiliate organizations that are across the country. Thank you so much for joining us tonight.